Hello, it's so nice to have you here today. This is a very important and potentially deadly topic that we're going to dig into. I'm your host, Debra. You're here at Answers About Alzheimer's, where we answer all of your questions about not only Alzheimer's disease, but other dementias. This is the place to go when you need help or direction. This channel was developed just for you, and for you to get the most out of it, be sure to comment often and let me and Answers About Alzheimer's know what questions or problems you're having. We take ideas from our viewers just like you, and we turn them into videos just like this. So comment and tell us what you need, because if you need it, more than likely others do too. There's a red subscribe button just below this video. You should click on that. I'll still continue playing when you click on it, so don't be afraid that you'll lose me. Go ahead and click on that red button. It's free, but it offers you some great benefits. By subscribing, you'll know that Answers About Alzheimer's has uploaded some new breaking news for you. So if you're like me and you have FOMO, fear of missing out, don't miss out. Click on the subscribe button. We're also busy. A little reminder once in a while for you to take a little break and spend some time with me. We all need a few minutes to detach and let our minds go somewhere productive and entertaining. I have been working closely with seniors for nearly 2 decades now. So I won't say I've seen it all, because every time I do, I witness something new. In my other business dealings with the senior population, this topic has crossed my path more times than I can count. We would get calls from either a family member or a healthcare provider saying that the patient has been extremely difficult lately, or the patient is more frustrated and confused than usual. These are big red flags. My feelers start vibrating. This could be an infection. This could be a UTI. I don't think I've ever suspected a UTI that didn't turn out to be one. Seriously. Very common. But for those families and care partners that haven't experienced this a few times, it can be very easily overlooked. Missing the warning signs of a UTI can be deadly if untreated. So it's so important that we know the warning signs and detect early. Before I get into infection causes, prevention, and diagnosis, let's define the urinary tract itself, because the infection can affect different parts of the urinary tract system. The urinary tract system, or the renal system, is very important to our overall health and well-being. This system filters our precious blood. Our body deposits nutrients to our cells and collects the toxins, keeping our body healthy. These toxins are liquid waste and keeps the body in balance. Without it, we would not survive. Our kidneys also regulate our blood pressure and controls the reproduction of our red blood cells in the bone marrow. The urinary tract or renal system consists of the kidneys, the ureters, the bladder, and the urethra. Starting with the kidneys, we have two kidneys. They're located in your lower back. The kidneys filter out our blood and turns toxins into urine. The kidneys balances our body fluids and releases hormones to regulate blood pressure and our blood volume. The kidneys remove waste and drugs from our bloodstream and controls the red cell production in our bone marrow. We have 2 ureters. They are thin tubes that carry the urine from the kidneys down to the bladder. These teeny tiny tubes are constantly constricting and relaxing, forcing the poisonous urine away from the kidneys. If the urine backs up or stands still, you can develop an infection. Connected to the ureters is the bladder. Think of the bladder as a triangular-shaped balloon. An adult bladder can hold up to 2 cups of urine for 2 to 5 hours, but don't do that. The urethra is next in the system. This is where it gets interesting, and here is where we're also learning about Alzheimer's and incontinence. The urethra is one tube that excretes the urine from the bladder to the outside of the body. The brain signals the bladder to squeeze out the urine. At the same time, the brain signals the sphincters to relax and let the urine pass out of the body. When all of these brain signals work properly, we void normally. So the problem here is brain signals and normally, because when we have dementia, nothing signals normally, does it? No. We've learned in past videos that the person with dementia's brain is not functioning normally. So this is one reason why we get UTIs in people with neurodegeneration. What should your urine look like? Well, normal, healthy urine should be transparent or see-through with a light yellow or straw color. Darker yellow urine, or urine that looks more like the color of honey, means that you need to drink more water. Even darker yellow or brownish urine can be a warning sign of severe dehydration or liver problems. Pinkish or red urine means that you may have blood in your urine. Your urine output should also not have a strong odor. When the filtered urine becomes highly concentrated with a lot of waste in it, it may have an ammonia odor. Some foods and medications can cause urine to smell like asparagus, coffee, Brussels sprouts. Oh, I hate Brussels sprouts. Garlic, honey, dried fruits, some vitamins. If your urine smells sweet or fruity, this can be a sign of diabetes or high blood sugar, but that's another video. So what causes a UTI? Because I am a huge believer in prevention. I preach prevention on so many topics. All right, so how do we get a UTI? A UTI is caused from bacteria that our body cannot omit on its own. The bacteria, in most cases, enters the body through the urethra and travels up into the bladder, causing the infection. Most UTIs are bladder infections. Now, many of us have harmless bacteria in our bladders that never cause an infection. 50% of women, 40% of men, and 100% of people with a catheter have this harmless bacteria and show no symptoms and no treatment is required. This is probably the best reason why those dipstick tests that you can pick up at drugstores may not be as reliable as going to the doctor for a clean catch urinalysis for diagnosis. How bacteria enters the body or the urethra is very simple and can result from many things. One is for us women, our anatomy is a little bit faulty. Our anus and our vagina are very close together, making it easy for microscopic fecal matter to enter the urethra and travel up into the bladder and bed down for an infection. Another common reason is improper wiping techniques. Women should be wiping from front to back. Yet another common risk factor for contamination is not fully emptying the bladder when voiding. So give your sphincter a little extra contracting. This is also good exercise to keep that muscle strong. If your sphincters are losing their elasticity and they don't close tightly, this can be compromising the renal system to bacteria. Having a catheter greatly increases your risk for the entry of bacteria. When you have dementia, you have even more chances of bacteria entering because with dementia, your immune system becomes more compromised. And we'll get into that a little bit deeper later in the video. So that's how bacteria enters the body. Now I want to discuss what to look for and how to detect a UTI. During the mild stage, you will not have any noticeable or distinguishable symptoms. When you begin to have symptoms, it is time to get to a healthcare provider ASAP. If you are experiencing burning, stinging, or pain while urinating, or if you have the urge to urinate frequently, and then when you do try to void, there's just a little bit of volume or just dribbles. If you have bloody urine or feeling pressure or pain in your lower abdomen or groin area, you may have a UTI. More severe symptoms, in addition to those we just talked about, would be fever, nausea or vomiting, back pain, abdomen pain, foul-smelling urine, bloody, dark, or cloudy urine, increased agitation, changes in behavior, and delirium. These are serious symptoms. You should not wait even 1 or 2 days for a urine test. Waiting after noticing these more severe symptoms can result in a delay in treatment and can then lead to permanent kidney damage or sepsis, which can be a life-threatening infection. My mother would just skip over the beginning symptoms and go straight to the fever. By the time she had any symptoms, she had a kidney infection and would have to go to the hospital for IV antibiotics. And this was before she had Alzheimer's. So go and get a diagnosis. You cannot begin the course of antibiotics until you've been diagnosed. These infections can travel fast, so don't delay. Antibiotics prescribed by the doctor will be either oral or IV. Be sure if you're prescribed oral antibiotics that you complete the full course and don't skip any doses, and don't stop taking them even if you feel better. Promise? Comment below, I promise. I'm all about prevention and being proactive. Let's come up with a plan to try to lower our risk factors of letting that nasty bacteria into our beautiful bodies. Number 1, stay hydrated. Bacteria cannot grow if it's flushed out and kept at bay. Keep your groin area clean and dry. Refrain from wearing tight underwear and wear 100% cotton undergarments. Women should avoid using scented products, and you should void your bladder directly before and after having sex. Avoid sugary beverages. Even cranberry juice should be little or no sugar added. When you feel the urge to go, go. Don't hold it in. And after voiding, take a moment to squeeze that sphincter a couple more times and make sure everything is out of the bladder. Just wring it out. Change absorbent briefs often, even if they are not wet, because they are a breeding ground for bacteria. The last prevention tip leads to the next segment, and that, ladies and gentlemen, is stress. This is the reason that people with dementia show heightened confusion and agitation with a UTI. Let me explain. It's really quite fascinating. When the body experiences stress, it releases a hormone called cortisol. Cortisol reduces the effect of the immune system fighting off infections. When this happens, cortisol affects the brain and the hippocampus, where our most recent memories are stored. Studies show us that with elevated cortisol levels, there was a direct correlation associated with cognitive functioning, memory impairment, executive functioning, language, processing speed, and more. I can't stress this enough. If you are not sure if your person has a UTI because you know they might not be able to tell you about their symptoms, or because of the brain damage, they may not even feel these symptoms, lean on the side of caution and get them tested. If you're a person with dementia or a resident in a nursing home wearing Depends or other absorbent garments or pads, it can make these symptoms even harder to detect. When wearing undergarments like Depends, it is vital to change them often, even if they're not wet. Depends and pads are breeding grounds for bacteria. Nursing homes need to be diligent in this effort and not wait until people are soiled to change into fresh, clean garments. Patients in nursing homes have a higher frequency of UTIs because they're immobile, They rely on others to stay clean and dry, they have a catheter, or they're already incontinent. As we age, the implications and severity of having a UTI can be deadly. These infections are common in nursing homes. 1 in 20 residents develops a UTI in an average month. These infections often go unnoticed by nursing home staff and can quickly lead to devastating falls, urosepsis, and infection of the kidneys and the ureters, and can also lead to septic shock, or it can also lead to septicemia. That's when the bacteria and infection go past the kidneys and reach the bloodstream. Both of these conditions, untreated, will lead to death. With so many residents in nursing homes having dementia and unable to communicate symptoms, it falls directly on the staff to keep up with hygiene and be overly aware of the symptoms. Staff in nursing facilities may not notice frequent urination if the patient is wearing protective undergarments. Never limit fluids. Remember, those with cognitive disabilities will not notice or be able to verbalize these symptoms. If you notice any foul smell in the urine or odd coloring or a spike in those dementia symptoms, get this patient to a doctor for a urinalysis immediately. Stay alert. I'm Debra Costu. See you next time. Thanks for tuning in to Answers About Alzheimer's, where we answer all of your questions related to dementia. So comment below, let me know what you need, what you're struggling with. You are not alone. Hit the like and subscribe.